Hi, everybody. So happy to be here with all of you. I'm Teresa Bertsch. I'm a psychiatrist, and I'm with the NARBA Institute. I'm the Chief Medical Officer and Chief Wellbeing Officer there, and also for our 2 affiliated behavioral health ACOs.
I'm Sara Gibson. I'm a psychiatrist in Flagstaff. I am the telemedicine medical director for Blue Cross Blue Shield of Arizona Health Choice. I was nauseous. I couldn't breathe. I was exhilarated. This is 1994, and Teresa and I were climbing Imogene Pass in Colorado, and she starts talking about the incredible shortage of psychiatrists in rural Arizona, and especially community Medicaid system psychiatry. And goes into this wild story about this thing called telemedicine, this strange access to care idea that she's got, and how they really needed a pioneer and a perhaps victim, but a person who was willing to step into this role to be the first real physician to do a telemedicine in this country. And for some reason I said yes. Why? Because we had a connection. Teresa and I had spent countless hours trail running and sharing stories about our families, solving all the problems of the world, and talking about our patients and our psychiatric practices, and really becoming a support and peer support for each other. So we had a connection, and I trusted her, and I said yes.
So now we are in 2024, and Sara and I have had over 30 years of working in parallel. And I remember the first time I met her. We were both just right out of residency. We were working at the Guidance Center, Community Mental Health Center up in Flagstaff, Arizona. And I'd only been at the job site for a couple weeks, and they had an after-hours meeting. So I was having withdrawal from my 1-year-old, and so I thought, I'm bringing my baby. And I walked into the room, and I looked out, and it was filled with psychiatrists who were all male, more than 15 years older than I was. And I saw Sara in the corner, discreetly trying to nurse her infant. And I looked at her and I thought, you are going to be my friend. And since then, we have been. And so in 2024, we have a similar problem as we did back in 1994. There just are not enough psychiatrists. In Arizona, we rank 48th in the US for mental health providers per capita. And when you look at Arizona, almost 97% of psychiatrists do not work in rural or frontier Arizona. They work in environments like Maricopa County and in Pima counties. And we are responsible for services in northern Arizona based on the roles that we have.
So I spent the next 30 years doing that. I was actually, as Morris Miller called me, the teleshrink, but I developed an expertise in telepsychiatry and in rural community psychiatry. But a new thing started happening where, as I became more and more experienced and seasoned, I was getting so many requests for supervision and mentorship from APPs in the system. And there was not enough hours in the day to help all of those requests.
Meanwhile, as part of my NARBA Institute work, I got deployed over to the Guidance Center again, and I was the chief medical officer over there, and I was needing to recruit. I was only supposed to be there about a year, help with accreditation, clean up some things, and then transfer back to the NARBA Institute. But it took me 5 years to hire a psychiatrist to take my place over there. In the meantime, I was trying to recruit for lots of different psychiatry positions, and there was an abundance of APPs. I had not worked very much with APPs. For the mental health APPs, it's a new industry, and was finding that they needed lots of support. There were no mentors for them to refer to. They immediately, after working just for a few months, had the desire to cut back on their work because it was so cognitively overwhelming for them. And there were no mentors for them to share their patient load with. And so, using the experience that both Dr. Gibson and I had with telehealth and running Project Echo programs, we decided that we needed to do something to improve the quality of care for our vulnerable psychiatric patients in the North. And so we started the Arizona Public Psychiatry Academy, and you can see a screenshot there of one of our sessions. And so what we have found, we just started our third session. It's a 6-month program yesterday. And we found that in terms of topics, people did increase their confidence significantly. They rated as 22%. We also measured well-being, components of well-being, and we found that 94% of them say that it contributes to a sense of professional fulfillment, as well as feeling less isolated and detached from peers. And while we build this as an early career program, we actually had lots of senior clinicians, psychiatrists join in, and they were very participatory and helpful and really wanting to be able to mentor people as well.
So we talked about the implications and impact. We had some surprises, however, is that we've talked a fair amount during this day about peer support, but mentorship is more of a circular pattern rather than a parallel pattern. And what we found is that our seasoned clinicians really got a lot of sense of joy and satisfaction, and dare I say wellness, from being an active participant in this whole mentorship program. And we were able to really focus on a community of practice, which was a new concept for me, and has been very much appreciated by everybody, and also gives us the opportunity to not only support each other, but also increase our own personal sense of well-being and enjoyment in our program.
So our call to action is to really consider doing mentorship programs like communities of practice. It's very scalable, especially over telehealth. It's not that expensive to implement. And it helps your more senior clinicians to be in a position of giving back all the years of experience that they have had and also the things that they've learned, as well as mentoring the early career program, early career clinicians as well. Our next step is to develop an Arizona Public Psychiatry Certificate program. And that's going to be a longer program, and we are going to be focusing more on individual mentorship in that program as well, and continuing to talk about advanced psychiatry, but also to do some of those soft skills that people don't necessarily get during their regular training. So thank you, everybody.
Okay.